Hello, everybody. My name is Lair Marin Markham, and I am the president of the Ohio Latina Mentoring Academy, and I also sit on the board as the education chair for the Columbus Hispanic Chamber. I'm here to present one of tonight's awardees. And before I begin, and foremost, I would like to congratulate UHCAN for its 23 years of advocacy. I have been working with UHCAN for the past 12 years, and I believe that is one of the strongest and the most forefront organizations that has helped our community in the health areas. And I continue to look forward to partnering and working more with UHCAN in the future. Well, let me tell you a little bit about our awardee tonight. Our awardee tonight's name is Liza Paul, and she is from Puerto Rican descent. I had the pleasure of meeting Liza approximately 6 or 7 years ago as she became one of the mentors for the Latina Mentoring Academy. As I grew and I learned more about Liza, I started to find out all the magnificent work that she was doing at Mount Carmel as the director for case management. In her many responsibilities, Liza has been providing leadership to her employees, and she has a very nice staff within her. And she has also become a champion of training, and she has led the case management department in very successful implementations. But not only has she been meeting the medical needs at Mount Carmel, but she has also stretched out and has done a lot of work out in the community. She has also organized Mount Carmel System's participation at the Latino Festival in the past 3 years, but she currently leads the Latino Business Resource Group for the Mount Carmel Health System as well. And she is a champion of diversity and inclusion for all the efforts in that health system. Besides all that work that she does in her free time, Liza is also a board member of Prospanica and has represented Mount Carmel in many of the Latino health care community events in her time also with Prospanica. Liza has also been a mentor for our Latina Mentoring Academy, and she continues to support us. One of the biggest efforts that I have heard and I have seen Liza do was when Hurricane Maria struck Puerto Rico. She led with only a couple of her family members a huge fundraiser, and she was able to chip out a lot of supplies and food for the community in Puerto Rico, her home of origin. We are very proud to let you know that she's a champion for health providers. She's one of the Latinas that I call a role model for a lot of people here, and that she continues to build more bridges, and she continues to create more support for everybody and for the work that she does. And with that, I would like to introduce this year's one of the awardees for UHCAN, Liza Paul.
Thank you, UHCAN, for awarding me this prestigious award. I feel truly grateful to be around this fantastic group of Ohio professionals that are being recognized this evening. They are truly making a big difference in the community, and that is really nice that you are willing to take your time and recognize them. I want to take a moment and thank my parents for the way that they have raised me and taking me to do home visits with them many times when I didn't want to. That actually taught me what a mission-driven leader is. And that is one of the reasons that I am here today, because of the way that they raised me and what they have taught me. I hope, Mommy and Papi, that I am making you proud. I want to take a moment and thank my husband, Rick, for all the sacrifices that he has done so I can do what I love, and for the beautiful family that we have created together. Long time ago, when I decided to become a social worker, I realized that I wanted to be a mission-driven leader. So this started when I was a child, and I will follow my dad to do home visits. He was a hospice doctor, and I will go with him and visit terminally ill people in their homes. And many times in Puerto Rico, the patients that he will see, they couldn't afford to pay him for a home visit. So he refused payment from them because he knew that if they paid him, something in the home had to be sacrificed, and he didn't want them to make a choice between seeing their doctor or getting the care that they needed. So one of the things that I remember was that I became a hospice social worker. and I did hospice social worker for 11 years strong. During that time, I went into a lot of people's homes. I took care of veterans all the way to Holocaust survivors. And it was a true blessing during that time for me to be in their home and that sacred time. And they opened their house to us, and I was able to be there at those specific times when they were getting ready to pass away. After that, I realized that my mission needed to change a little bit, and I left the care at the bedside and moved into a management role. I have been in management for the past 9 years, and I have been supporting mostly nurses and social workers during this past few years. I have been supporting the team from emergency department to maternity ward to hospice to orthopedics. So I have been in different areas, and now I am supporting Medicare recipients. My team is managing behavioral health and providing case management to those members. So the goal that I have as a leader for them is that I want to remove barriers. There is a huge need, specifically with the elderly right now, and everything that we're dealing with. So I want to remove barriers for them so they can meet the needs of the patients, so they can take care of the patients. And so when they go to bed at night, they're able to realize, hey, I made a difference. So that is my goal as a professional, and I want to thank UHCAN for this award. Thank you.